Welcome to Knowledge Park. Types of Endoscopy. Part 1. Many people worry about feeling exposed or vulnerable during the procedure. Please know that patient dignity and modesty are paramount. You will be covered with a sheet at all times. The medical team maintains a professional, focused environment. Their entire goal is your health and comfort. You are not just a body on a table. You are a person they are dedicated to helping. It's helpful to understand why you're having the procedure, as there are 3 main types. Screening. This is done when you have no symptoms, to look for hidden problems. A colonoscopy at age 45 is a perfect example. It's preventive health. Diagnostic. This is when you have symptoms, like pain or bleeding, and the goal is to find out why. Therapeutic. This is when the procedure is used to treat a problem, like removing a polyp or stopping a bleed. Often, a single endoscopy can be both diagnostic and therapeutic. Have you ever wondered how doctors can see inside your body, your stomach, your lungs, or even your joints without making a single large cut? It's a question many of us have when faced with a persistent, unexplained symptom or an internal health concern. You might feel a discomfort you can't quite place, or your doctor may have identified something that needs a closer look. How can they pinpoint the exact cause of a problem, or even perform a treatment, all while you are resting comfortably, often peacefully asleep? In the past, the only way to get these answers was through major surgery, which came with significant risks and a long, painful recovery. Thankfully, medical science has evolved. The answer now lies in a remarkable medical marvel called endoscopy. It is a procedure that has completely revolutionized how we diagnose and treat countless health conditions, offering a safer, faster, and far less invasive alternative to traditional surgery. It represents a pivotal shift in medicine, moving from large incisions to micro pathways, from long hospital stays to outpatient care. For many, the word endoscopy can sound intimidating or mysterious. It's completely natural to feel a little apprehensive about a procedure you don't fully understand, but our goal today is to lift that veil of uncertainty. By the end of this video, you will see it for what it truly is. A powerful and gentle window into your health, designed with your safety and comfort as the top priority. Today, we are going to explain it all, step by step, so you feel informed and empowered. We will learn what an endoscope is and how this incredible technology works. We'll explore why your doctor might recommend one, the different types of procedures, then exactly what to expect before, during, and after your procedure, so you can feel prepared and confident every step of the way. So, let us take a journey inside the human body, without ever leaving your seat. Ready? Let us begin. So, what exactly is an endoscopy? The name itself offers a clue. Endo means within, and scopy means to look. In the simplest terms, it is a procedure that allows a doctor to look inside your body using a highly specialized instrument called an endoscope. Think of the endoscope as a tiny, sophisticated, and incredibly flexible camera crew, designed to navigate the natural pathways and hollows of your body with precision and care. It is a long, thin, flexible tube, often about the thickness of your little finger, with a bright, cool running light source and a high-definition camera on its very tip. This isn't just any camera, it's a marvel of miniaturization, capable of capturing incredibly detailed images. As the doctor, a specialist trained in these procedures, gently guides this tube inside, either through a natural opening like the mouth, or through a tiny keyhole-sized incision, the camera sends crystal clear, real-time video images to a large television screen in the procedure room. This gives the entire medical team a direct, magnified view of your internal organs, allowing them to see the color, texture, and health of the tissue with a level of detail that was once unimaginable. But an endoscope is so much more than just a camera. It is a keyhole into your body, unlocking diagnostic and therapeutic capabilities that once required major open operations. It is a minimally invasive tool, meaning it helps doctors diagnose with precision. The endoscope also contains tiny channels, like hidden tunnels, that allow the doctor to pass specialized miniature instruments through the tube. The endoscope is a marvel of miniaturization. It doesn't just have a camera and light. It has a working channel, a tiny tunnel for miniature tools like forceps for biopsies, loops for removing polyps, or clips to stop bleeding, without any additional incisions. This allows them to treat problems on the spot, like taking a small tissue sample, called a biopsy, for further testing, or removing an abnormal growth like a polyp, all without the need for major surgery and large incisions. This approach is often called a see and treat procedure. It means less pain, less risk of complications, and a much faster recovery for you, allowing you to get back to your life sooner. Why might your doctor suggest an endoscopy? It helps us look inside your body clearly. It can find answers when other tests cannot. There are many reasons. The main goal is the same. Look directly inside and find what other tests might miss. First, it helps when you have symptoms we cannot explain. Maybe you feel unwell and no one is sure why. This could be stomach pain, bad heartburn, or nausea. It can also be trouble swallowing, signs of bleeding, or weight loss you cannot explain. Endoscopy can often show the exact place of the problem. Second, it helps diagnose conditions by seeing them directly. The camera is high definition. It can spot ulcers or swollen areas very clearly. It can also find small growths called polyps and possible tumors. Third, we can take a tiny tissue sample. This is called a biopsy. Do not worry. It is quick and painless. Tiny tweezers go through the scope and take a piece the size of a pinhead. You cannot feel it because the inside lining has no pain nerves. The sample goes to a lab to help confirm the diagnosis. A pathologist looks at it under a microscope to give a clear answer. It is a tiny sample, and the process is painless. You may feel pressure or fullness from air, but not pain from the biopsy. It's like the inside of your cheek. Pressure, not a cut. Fourth, endoscopy can also treat problems. Special tools can stop bleeding from an ulcer or remove polyps, often during the same visit. We can also gently stretch a tight esophagus or remove something that was swallowed. In short, endoscopy helps your team see clearly, decide with confidence, and treat effectively, all with one small, gentle procedure. Let's complete our journey. For each body system, there's a dedicated endoscopic test, matched to specific symptoms and goals. Upper endoscopy, esophagogastroduodenoscopy, or EGD. Path, from the mouth to the esophagus, stomach, and duodenum. Situations, heartburn, upper belly pain, trouble swallowing, vomiting blood, or black stools. Purpose, find ulcers, inflammation, celiac disease, and cancers, and treat bleeding or widen narrowed areas. Digestive system first, direct vision with targeted treatment when needed. Colonoscopy, path, from the rectum through the entire colon. Situations, routine screening at 45 and up, blood in stool, bowel habit changes, or IBD checks. Purpose, prevent cancer by removing polyps and diagnose lower gut problems. Sigmoidoscopy, path, rectum to the sigmoid and descending colon. Situations, rectal bleeding, left lower pain, or diarrhea. Purpose, a focused lower colon look with simpler preparation. Enteroscopy. Path: advanced scope deeper into the small intestine. Situations: suspected small bowel bleeding, tumors, or Crohn's disease. Purpose: reach beyond standard scopes to biopsy and treat. ERCP, endoscopic retrograde cholangiopancreatography. Path: from the duodenum into the bile and pancreatic ducts. Situations: jaundice from blockage, bile duct stones, duct tumors, or chronic pancreatitis. Purpose: remove stones, place stents, and sample tissue. Bronchoscopy, respiratory system. Path: nose or mouth to the trachea and bronchi. Situations: stubborn cough, coughing blood, a lung shadow, infection, or a swallowed object. Purpose: look directly, take samples, and clear blockages when needed. Arthroscopy, joints and musculoskeletal. Path: tiny incision into a joint. Situations: pain, locking, swelling, or suspected tears. Purpose: diagnose and often repair cartilage or ligaments in the same session. Cystoscopy, urinary system. Path: urethra into the bladder. Situations: blood in urine, frequent infections, incontinence, or bladder pain. Purpose: inspect, biopsy, and remove small stones or tumors. Laparoscopy, abdomen and pelvis. Path: small incisions for a camera and instruments. Situations: unexplained pain, endometriosis, ectopic pregnancy, or minimally invasive surgery. Purpose: view organs and operate through tiny ports. Hysteroscopy, reproductive system. Path: through the cervix into the uterus. Situations: heavy or irregular bleeding, infertility, or miscarriages. Purpose: inspect the cavity and treat fibroids or polyps. Ureteroscopy, urinary tract. Path: from the bladder into the ureter toward the kidney. Situations: stuck kidney stones or ureter tumors. Purpose: visualize fragment stones and biopsy. To keep this episode concise, we'll conclude here. Episode 2 continues with nephroscopy, neuroendoscopy, capsule endoscopy, mediastinoscopy, thoracoscopy, EUS, laryngoscopy, and nasal sinus endoscopy. Also, steps and what doctors see, risks and safety, community and questions. Don't miss it. Thanks for watching. Please like, share, subscribe, and hit the bell. See you in part 2.